Well, hello, everyone. My name is Joanna Thompson, and for the past 10 years, I've worked at Highlands Oncology Group in Fayetteville, Arkansas. I'm the director for our multidisciplinary lung cancer clinic, which is actually celebrating 20 years this year. 5.5 years ago is when we decided to start our lung cancer screening program. I was charged with developing and implementing the program. I have remained the director for our lung cancer screening throughout the past 5 years, handling all the day-to-day management tasks and continue to work on program growth and improvement. We are located in Northwest Arkansas and serve a population of over 500,000. We also see a lot of patients from smaller, more rural cities in our surrounding area. We have patients that will drive 2 to 3 hours to be seen either through our multidisciplinary program or lung cancer screening. Our program is a bit unique in that we bring doctors from the community together who have no financial ties or are even in the same clinic system with known or suspected lung cancer the best possible care. We have been meeting once a week for almost 20 years. We have clinic for 4 hours every Tuesday where oncology, pulmonology, and CV surgery all come together under one roof to see patients. We end our day with a 3-hour lung cancer conference where we discuss patients who were seen in clinic, as well as review any LungRADS 3 or LungRADS 4 CTs that were done the week prior. We do low-dose screening CTs at 3 different locations. We use 2 different scheduling systems, 2 different EMRs. Thankfully, we are all on the same PACS system. Scheduling patients in 2 different systems has been full of challenges when it comes to the patient tracking and data management. Whether you are just starting out, have a mature program, do everything in one system, or are spread across multiple systems, I believe our journey through patient tracking and data management can be helpful as you move forward in your program. To give you a bit of history, we began our program in 2013. We saw 37 patients and did 37 low-dose CTs that year. We were tracking everything on paper. Nothing was automated, but with 37 patients, I was feeling really great about paper tracking. In 2014, though, you can see our numbers increased quite a bit to 831 patients. We did over 1,000 CTs that year. At this point, I was feeling a little less like I had it all together with paper tracking. In 2015, we did over 2,000 low-dose CTs and had 1,500 plus patients in our screening program. We started using an Excel spreadsheet along with our paper method to help in tracking patients. If you're wondering how this was going or how I was handling this as the program director, this picture pretty much sums it up. I feel like someone walked into my office and snapped this picture. Let's just say it was not going well and I was not handling it okay. But how many of you have also been there or maybe are there right now, feeling so frustrated with patient tracking and data management, you need a good solution or you may just give up. Just so you know, you are not alone. Some of the problems we were experiencing with workflow were due to volume and the lack of an effective tracking tool. Some of the issues we were experiencing were patients behind in screening workflow, patients being lost to follow-up. We were unable to produce data in a timely manner. I was not confident in the accuracy of the data that I did produce. Our current EMR would not work for lung cancer screening. I'm based in a private oncology practice, and at that time, we were using an EMR that was specific for oncology. No matter how difficult running a program can be, especially during those early years, it is important to remember it's not all bad. Even though we were struggling with patient tracking and data management, in 2015, lung cancer screening was becoming popular in our community, which was a big win for us. Lives being saved by early stage lung cancer, we were finding 1 in 70. And let's not forget about the downstream revenue, which I will talk more in a couple of slides. At this time, we had not been approached by any reps and knew of no professional tracking software on the market for lung cancer screening. This was towards the end of 2014, beginning of 2015. I went to my immediate supervisor and made the case that this was not responsible screening and one person was not capable of handling all this paper tracking. and responsibly keeping up with patients. Thankfully, I do have a lot of support in my program, very supportive manager, and the best physician champion. They allowed me to hire an assistant, but it was obvious that even the addition of an extra person, we needed a more efficient and effective way of tracking. We decided the best route was to hire a programmer to create our own customized database and tracking program. Here is where one of the lessons learned came into play. Through the grapevine, someone knew someone they thought did this kind of thing, and boom, we hired them, just like that. They got to work after just a few emails back and forth. I probably don't have to tell you that this did not work out well. We ended up wasting time and money. The second time around, it went much better. Here are some tips you can follow if you decide to go this route, which, let me say, building a customized software is a great option. Number 1, interview multiple programmers. During the interview, watch for someone who gets it, someone who gives you ideas and brainstorms with you. This will show they have experience building from the ground up. Watch for them to describe ways they would build it and ways they will implement what you are telling them. You want to know they can put your vision into something workable. Create a vision list for your software. Do this before you begin to interview. I did it backwards the first time. I didn't really have a list before I started interviewing. Make sure you include your wants. Here are a few of the ones that I wanted, that I had on my list when I was interviewing programmers. I wanted to be able to track all appointments across multiple systems and sites in one program. Collect risk assessment information electronically. Track results. Easily add data collection fields. Programs are always changing, and what you need to collect this year may be different from what you need to collect next year. So being able to go in and modify or add data fields easily is key. I wanted everything we entered, all of the time and effort put in to get everything into an electronic system. I wanted everything entered to be mineable data where we could run reports on it. Which brings me to the last thing, is being able to run reports in the matter of seconds to produce accurate data. This solution is great because it's personalized, is fairly inexpensive when compared to professional software. I think we spent about $10,000 on our customized software. Now, even though our personalized software was created, and it was great for so many things, mainly it was good for data and for reporting. As our numbers continue to grow, we have now screened about 5,000 patients and do thousands of CTs every year. We still struggled in a few areas and needed solution to these struggles. Patient appointment tracking. When was the patient due? We needed something to keep us on track. Efficient result letter creating, printing, and sending. We were using a template in Microsoft Word, filling in the name, date of birth, and lung grads on each patient by hand. We were easily spending 15 to 20 hours a week doing letters. We also had inconsistent measurement of nodules by the radiologist, and uploading to ACR, we actually were not even doing it at that point because it was such a struggle. We could have put more money into our software and hoped that it worked, although I don't think we would have ever been able to upload to ACR automatically, which was a key for the program. We were approached by a professional software company, and after viewing their program, we made the decision to purchase and implement it, along with our personalized database. Why we chose the system we did. We went with a software that offered patient tracking portal as well as a CAD for our radiologists to utilize. Utilizing this software, the CAD system interfaces with the Navigator portal and sends lung rad results automatically after the radiologists read and give a lung rads. This creates the letter automatically in the Navigator portal, and all we have to do is click a button and print the letter. We're now able to do our results letters in 3 to 5 hours a week. We can set target dates, and the system alerts us when a patient is due for a scan. We have had no issues with upload to ACR. It's been very seamless. We had planned to eventually give up our own database that we created, but have found that the data portion is very valuable and better than anything offered by a professional software at this time. So my advice for finding the right solution and helping to get it paid for. Get a program as soon as you can. Dealing with retro data is a headache and very time consuming. So if you can get this early on in your program, good for you, that's great. You'll save a lot of headache in the end. Here's some advice for getting started. First of all, make a list. What are your current issues? Are patients falling through the cracks, not being scheduled on time? This is especially important on lung rads 3s and 4s that are needing diagnostic follow-up CTs. This is something to point out to your supervisor or administration if you're having problems keeping up with these and getting them scheduled on time. How much time are you spending creating letters? What are things you could be doing with that time? What are your needs? An example is appointment tracking, a system that automatically alerts you when a patient is due for their next appointment. I like a reminder 8 weeks prior. This gives us time to make multiple attempts to reach patient and send no response letter if needed. Another example is easy result letter process. You need something that automatically creates a letter and doesn't take you a lot of time. There are other things such as growing the program you can be spending your time on. What are your wants? Example, I wanted to be able to run reports based on physician. How great would it be for your program if in the matter of a minute you could know Dr. Smith referred 200 patients to the program in 2018. He had 3 cancer found among his patients, and 2 of those were a curable stage 1A. You can show up to Dr. Smith's office with some cookies and balloons, congratulating them on the lives they've saved simply by referring to your program. I bet after that they will be sending even more referrals, or will at least encourage them to continue to consistently refer. Or on the flip side of that, you can use this tool to go, I see Dr. Smith referred 200 patients in 2017, but in 2018 he only referred 50. Maybe I should check in with his office about the screening program. This is a powerful tool for you to have at your fingertips. I use our customized software for reporting on physicians. There may be a professional vendor whose software offers this, but I haven't seen one at this time. Another thing to think about when making your list is, what does your administrator or lead physician want? Example, monthly reports of PETs done through lung cancer screening program. I bet they would love to get a monthly report on their desk about billable events that have come through the screening program. Use the list we just went through when interviewing programmers or looking at demos from vendors and professional software. This will help you decide if you need a personalized software, a professional software, or if you need a combination of both. Which one will solve your biggest headaches? That's what you need to find out. I highly recommend interviewing multiple vendors for professional software and multiple programmers if you're going to go the route of custom software. Have your list of needs and wants to get solid answers. Have them show you, not just tell you, how their software will solve your problems and give you tools to more effectively run your program. And last but not least, I know that every program navigator struggles with getting this paid for. Whether you're looking at a customized software or professional software, it can be expensive. If you have a lead physician, start there. Have numbers and examples to show. If you can get the lead physician on your side, you will have an easier time getting administration on board. For administration, pull all the data you possibly can, and know that this can be hard to do. I mean, isn't this why you need a software in the first place? To be able to pull data? So you may have to start out doing this by hand, and it will be hard, but you can do it. Another thought on this is sometimes you can use billing data to pull numbers. Can you ask your billing office manager to pull all patients who are billed for a low-dose CT and who also were billed for a PET scan? And let's not stop at PET scans. We should be reporting on any billable service that came through the lung cancer screening program. This can include diagnostic low-dose CTs, CT of the chest, abdomen, and pelvis, thyroid ultrasound, pulmonary referral, CV referral, oncology referral. How about the radiation referrals? Surgical procedures performed, resections, biopsies, CT-guided needle biopsies, anything that was done as a direct result of a patient coming through your lung cancer screening program and now have a billable event in your system. You may even try to see if there are patients who never had a billable event in your system, and now, after coming through your lung cancer screening program, they are being seen in your system. Now, don't feel like you need to have dollar amounts for all of these things. This many PET scans brought in this much money. You just need to know how many PET scans, how many referrals to specialties, how many other diagnostic tests have been done. Administration can take your number and quickly put a dollar amount on it. Now, don't make it all about the numbers, although administration does love numbers. Make sure you include how many patients have been screened, how many physicians are utilizing your program, how many cancers have been found, break it down into stage 1 through 4, and emphasize the lives that have been saved. In closing, please know this: you are not alone. There are so many of us out there fighting the same battles you are. Keep up the good work and continue to be an advocate for lung cancer screening and process improvement within your program. We do it for the patients. I'm always happy to help if you have any questions or just want to talk and brainstorm with someone. Please feel free to contact me via the email or phone number on the screen.